For joining us for the NAPEBT Vendor Days event. So my name is Nathan Olson. I work directly for Blue Cross Blue Shield of Arizona, and I'm happy to be presenting today. First thing we'll go through are the three different benefit options that you have access to. A word of note when we go through each of these is that all of the programs are on the same network of providers, which is our national network. And today I'm going to be highlighting specifically the in-network benefits. Each of the plan designs has both in and out of network benefits. Remember that an in-network benefit provider is someone who holds a contract with Blue Cross Blue Shield of Arizona or one of our partner plans. So the very first plan that we'll talk about today is your buy-up plan. So with this plan, this would be the largest expense out of your paycheck and the least expensive when you go to access care. And that's how we tend to look at each of the plan designs. So with this plan, the buy-up option, you guys have a copay for your most utilized services. Right in the middle here, you can see that your office visits would be $35 for a primary care physician or $45 as a specialist. If you're seeking urgent care services, that would be $60 flat charge. And then emergency room, this is, remember, the most expensive place to seek care, would be a $200 access fee, then deductible coinsurance after that. When we talk about this plan design and we talk about hospitalizations, both inpatient and outpatient, this is where we get into a deductible. Remember that a deductible is an amount of money that you need to meet before insurance actually kicks in. So if I'm scheduling an outpatient surgical procedure and the cost is $350 to remove some type of skin lesion, then I would pay the full $350. That would go toward my deductible. I would continue paying those deductible expenses until the $750 was met. Once that was met, then we would go into what's called coinsurance, where insurance begins picking up 80% of those expenses. You would pick up the other 20%, and that would continue until you reach that out-of-pocket limit. And that's down near the bottom. It's the $8,700 per person with a maximum of $17 per family. Remember that on all three of the plan designs, your preventive care, and I actually have a full slide on this, is covered at 100%. So no cost to you for things that are preventive in nature. And of course, your pharmacy continues to be covered through CVS Caremark. The second plan design operates much like the first. This is your base plan option, and your difference in care here would be a raise in your primary care office visit and your specialist. You see that change from $35 to $45 and $45 for specialist to $65. Your ER is the access copay is $100 more expensive, and your urgent care is $20 more expensive. I will note on here that though the deductible did increase, your out-of-pocket maximum remains identical. So if you're a person who you know you're going to meet the out-of-pocket, then this may actually be a better plan for you than the prior plan, only because this plan is going to be less costly out of your paycheck than the prior plan. So if you know that you're going to meet that out-of-pocket, then this plan will save you some money in your per paycheck cost. And so this is something to consider. And that would be the exact person that I would say that this plan is more geared toward. The third plan option is your saver plan. And keep in mind that there are typically two parts to this. The first piece is the type of medical insurance that you're buying, which is called a qualified high deductible health plan. And the second piece of that is a health savings account, which is actually a financial tool offered through the IRS. So the first piece of this qualified high deductible health plan, we say that it's qualified because it must meet certain IRS conditions in order to give you access to that financial tool called a health savings account. The first piece of this is actually the qualified part is it is a high deductible health plan, meaning that your deductible has to be of a certain height in order to make this a qualified plan. With this plan, it also operates a little differently in that your preventive care remains covered at 100%, just like the prior two plans. But to make this plan a qualified plan, all of your non-preventive care must go toward your deductible. And you see that the deductible on this one is $1,750. And I'm going to go into a little bit more detail in a moment. But when I say your non-preventive care, let's talk a little bit through about what those costs typically run. If I'm going to see my primary care physician for the flu and their contracted rate is $64, then I would pay the full $64 and that would go toward my deductible. The next step up in care in this type of scenario would be your convenience care clinics. They typically run about $150. You'll find those in places like CVS or Walgreens. The next step up in care is urgent care. They generally run anywhere between $150 and $250. So that is the next step up level in care. And then finally get to the emergency room, which is once again the most costly place to seek care. So at the emergency room, you're typically seeing around anywhere from $1,500 to $2,000 billed for a visit like that. So a single trip to the ER could easily meet the deductible on this plan. Once again, I mentioned that preventive care is covered at 100%. The other thing that we're going to go into, the co-insurance works just like the other two plans in that after your deductible's been met, insurance begins to pick up 80% of those costs. You would continue to pay the remaining 20%, noting that your out-of-pocket limit is lower on this plan than the other two plans. So for some folks, this plan may be actually a better plan design depending on whether you reach that out of pocket or not, as this one saves you over $3,000 in that cost. The other thing that I like to note on this type of a plan design, we talk about the qualified portion of this. So there's a different way that this deductible works in relation to the other plans. The other plans limit your deductible exposure first as an individual and then as a family, but you have an individual protection there. On this type of a plan design, that deductible of $1,750 is actually not high enough in order to make this a qualified plan when you're enrolled as anything other than employee-only coverage. So on this type of plan design, if you have a spouse on the plan covered underneath you or a child, the individual deductible on this goes away and it becomes a family $3,500 deductible. And that's an important distinction on this plan. So once again, if you're employee-only coverage, your deductible is $1,750 and your maximum out-of-pocket's $5,000. But if you're anything other than employee only, it becomes a family $3,500 deductible, also with individual and family maximums. So it's an important distinction to note that the deductible works very differently on this plan versus the prior two plan designs. Okay. Once again, we're talking about in-network benefits. And once again, this is our national network. Lastly, pharmacy continues to be covered through CVS Caremark on this plan as well. I know I'm moving somewhat quick. That's because we just have 25 minutes and wanted to leave room for questions. So next, we're going to go under best practices, understanding the network, and your treatment options. We mentioned this earlier, in-network versus out-of-network providers. Make sure that you're seeing someone in network. And if you're scheduling a procedure, you want to make sure that things like your surgeon, your assistant surgeon, the facility, and your anesthesiologist are all in network wherever you have control over that. Arizona, beginning July 1st for you guys, will have the law in place, the No Surprises Act. So that will assist in that, where providers will openly make you aware of where they are in network and they must accept our in-network reimbursement. So those protections are coming. But once again, that was effective for 1/1/2022 renewals and after. So just be aware of that. Out-of-network providers are anyone who does not have a contract with Blue Cross Blue Shield of Arizona or one of our partner plans. So be aware that with out-of-network, they are able to bill what they see fit, and they once again do not hold a contract with us that limits your exposure. For care options, note that we have a separate network called our Blue Distinction Network. It is included with your plan. It is part of that overall PPO network. But Blue Distinction are those providers who have a material difference in the care that they provide to you as a member. They typically specialize and have much lower complication rates. They have better mortality rates. They have fewer redo procedures. And because of all of that, they have shorter length of stays within the hospital. Because of that, they actually have a lower cost to them as a result. So they practice a higher standard of excellence. And so if you are looking for one of these areas of specialty care on the right, keep in mind that these the Blue Distinction Network is where you want to be if this is where you're looking for care. So wanted to make sure everyone was aware of those types of differences. Moving on to tools and resources. The MyBlue portal has access to all of your benefits. They have access to forms and resources. If you want to search the network, if you want to check out our cost comparison tool, which will actually tell you differences in cost between providers for a particular procedure, you have the ability to do that. Of course, your ID card is here. So if at any time you want to download a quick PDF of your ID card, you can do that either here or on our mobile app. Super convenient, super easy to use, but I encourage everyone to log in and register. This is also a great place if you're considering that high deductible health plan to actually download your claims from the current year and then take a look at what the difference would have run you should you been on the high deductible health plan. So utilizing those same services as you move forward. And the way to do that is simply to download your claims and add up what you spent on your end. So say your primary care copay, plus what the insurance paid for that particular visit. And then you would, once again, that's for non-preventive. And once again, that would tell you exactly what your cost would have been had you been on the high deductible health plan. So if you want to understand how your cost would impact you going forward, you could take a look at the prior year or the prior 2 years and then make that assessment. You can download your claims right to Excel for easy calculation. And then, of course, if you're considering that plan shift, make sure to take into account what your per paycheck deductions are for each of the plan designs, along with any contributions made by your employer. We mentioned this briefly, but if you want to track your deductibles, your out-of-pockets, take a look at your claims, search on a particular physician to find out whether they're in that Blue Distinction Network. You have the ability to make all of those choices right on the website. I mentioned this a little earlier, but the cost comparison tool can actually allow you to search up tests, treatments, procedures, and find out what the average cost range is, along with specific costs for providers. And the other piece of this is to make sure if you're talking about a procedure, that you're pricing in the surgeon, the anesthesiologist, the facility. But you can see based on this search for an endoscopy that there are between two of the local providers here, that there's a massive difference in price between these two. And so know and understand what your treatment options are and that different providers may charge different costs for the same or similar procedures, tests, treatments, those types of things. One of the big differences that differentiate us from our competitors is that we are the only carrier that actually has in-person offices that you can actually make an appointment with and show up to go over any claims issues. Keep in mind right now that the Flagstaff office is just going to be reopening shortly. It has been closed due to COVID, but our customer service teams are all here locally. So they're the same folks that know about Arizona issues that you would be working with and dealing with. In addition to that, we have 12 years average service experience by everybody. So a plethora of knowledge in the background. And of course, we are bilingual as well. Accessing resources. So we mentioned the different types of care, especially on the HSA plan and what that would actually cost you. The first level line of care, the easiest line of care, is our nurse on call program. Our nurses are available 24/7, and I would absolutely highlight that if for me and my family, we actually save this nurse on call phone number into our phones as a contact. And you want to do that for every member of your family. So you're not hunting down this phone number. You're not having to look for it. But my recommendation, once again, is to add the nurse on call as a contact within everybody's cell phone. Once again, it is free, and they can do things like look up medication side effects. They can talk to you about how involved is a procedure, what's the expectation on recovery time for a procedure. They can do all of that right over the phone. Our next level up in care is the Blue Care Anywhere. This gives you access to physicians 24/7, 365. And this is another benefit. I would actually download the app and register for the service prior to needing to use it. We include both medical, and I should mention that on the buy-up and base plans, this service is free of charge. And it includes both mental health as well as minor things. So this is meant for minor services. If you've got a rash, think pink eye, those types of things. But once again, they will ask all the same questions as a physician's office. So things like your allergy questionnaire do need to be completed, and that's why I advocate registering for the service before you need to use it. But this is one of the less expensive avenues to care, especially if you're on the base and buy up at no cost. And then once again, it does include mental health as well. If you access our share care resources, we have lots of things, including personal coaching. So if you want help with weight loss or with maybe quitting smoking, all of that is available through our share care partnership. The other big share care partnership is OVIA. OVIA is our maternity support program. You can see on the screen some of the different services that they offer, but there's fertility, there's pregnancy. We do give you a reward for enrolling in a pregnancy program. This is our version of a healthy pregnancy program, and the real core piece of this program is to identify and have the resources necessary should your pregnancy become high risk. And that's really the biggest fear with pregnancy is a high-risk pregnancy. But they have programs starting with fertility itself all the way through the first couple of years of parenting. So note that OVIA is available as well, and that there's a reward for this one. All right, that ends my formal presentation. At this time, we can open it up to question and answer. I know I moved pretty quick, but wanted to leave a couple of minutes for this. And Danica, if you want to turn off the recording.